I was motivated to pursue a career in clinical psychology because I did a module in neuropsychology when I was studying for my psychology degree, and I just found the human brain really fascinating and I wanted to know more about it. And so I ended up pursuing a research PhD in neuropsychology, where I found out a lot more about the human brain. And I mean, in doing so, I got to work with some people that had been affected by stroke and brain injury. And just during that experience, the people that I worked with were so helpful and so engaged in helping me with my research that I felt really frustrated that I couldn't do more for them. So that experience really made me think about applying for clinical psychology so that I could eventually end up working with people with brain injuries and be able to do something helpful for them as well. I think what I most enjoy about my role working with people with brain injuries in a community brain injury service is about being able to add some value to people's experience. So I often, I guess it's a specialist area. So over the years, I've acquired kind of specialist knowledge about brain injury and techniques in neuro rehab. And I like being able to work with people who are the experts in what it's like to live with brain injury and put those two pieces of knowledge together so that in collaboration we can help people find a way to move forwards. So it's a really meaningful experience being able to do that with people and just talking every day about things that really matter. And I guess I get to work with a really diverse range of people, so from 16 years old to people in their 90s in different stages of life, and I get to work with people and know people well that I would never otherwise have encountered, and that's a really rich experience. So in the last 5 years, we've been working to develop new models of rehabilitation for people in our service. And one of the reasons that we wanted to do that is that we've been doing lots of work on well-being, and really the research shows that well-being is not the absence of impairment. And lots of the models that we use in healthcare and in neuro rehab are about reducing impairment. And of course, lots of the difficulties people face after brain injury are long-term and permanent. So in order to help people experience well-being, we also have to focus on helping them live with some of those difficulties. And so we wanted to create services that not just aim to reduce difficulties, but also help to promote well-being. And so we've ended up doing lots of research and publishing some theoretical models about what actually the core components of well-being are. And lots of the work that we've published has talked about how important social connection is. And obviously that's very important for people with brain injuries because they can become very disconnected and socially isolated. It's also talked about the importance of health behaviours like healthy diets, exercise. And we know again that people with chronic conditions can find it difficult because of the limitations of their condition to engage in health behaviours. As well as positive experiences being really important for well-being. And very often after brain injury, people say that they've got limited opportunities to experience positive emotion and positive experiences. So at the heart of what we're doing now, we're trying to put interventions in place that promote health behaviours, give people opportunities for positive emotions, positive experiences, and connections with others. So we've developed a series of groups. I mean, I guess by means of an example, we've developed a group with a construction company in Swansea because we've got a lot of young patients that want to develop practical skills and want to be able to return to work. And the construction company work alongside us. We input the rehabilitation and they teach the people we work with practical skills in plastering and building and renovating houses. And together we kind of support people to gain new skills and experiences that feel meaningful for them. And the important thing about that example is that it's about working with community providers and businesses to help bridge the gap between healthcare and the community, so that we end up helping people integrate into their communities in order to promote sustainable well-being in the future. One of the things that I find most challenging about working in neurorehabilitation can often be this conflict between the kind of the medical model, which I've talked about, which inherently there's an assumption that you're the expert and you're treating somebody that's a patient. So there's an imbalance of power in that relationship, and that you can do something to that person to fix their difficulties and return them to a pre-injury state. That model works exceptionally well for acute medical conditions, but it's been inadvertently applied to chronic conditions. And sometimes that's a real challenge, because I think we'd be doing a disservice if we only aim to reduce impairment rather than promote well-being and help people live meaningful lives after their brain injuries. And that can be quite challenging, because you work with lots of different professions, and some of them are very much trained in that model, and then you've got other professions that aren't. And I guess it's about, one of the challenges is about trying to find some common ground for how you can develop more holistic biopsychosocial models of care that support the whole person. So I think if I had to give some advice to somebody that was thinking about a career in the field of neurorehabilitation, I would certainly say that I found it to be a really rewarding and fulfilling career. So to go ahead and do it, I mean, working in this field requires a lot of additional knowledge. So if there was an opportunity to seek some specific training, that would be very helpful. But also just to keep reading the literature and to keep up to date with things informally. And I think one of the most important things for me working in community neurorehabilitation services with different colleagues in the multidisciplinary team is to really just keep trying to check in with your team to make sure that you're on the same page. And the other advice I'd give to people is, sometimes as human beings, we find it very difficult to jump in and try to fix problems before we really understand them. And one of the things that I've sort of learned over my career is that one of the most helpful gifts that you can give someone is to really hear their story. And sometimes you can't fix it, but the power of being able to stand alongside someone and give someone the gift of feeling that they've really been listened to can't be overstated. In terms of how I think nurses could play a greater role in supporting the recovery of people experiencing brain injury, I think there really needs to be an emphasis on within the profession about the additional specialist skills that a neuro nurse would have, and potentially a training course to support some of those additional knowledge, some of the additional knowledge that nurses require. And the reason I say this is because it strikes me that some of the nursing training to work on some of the medical wards, and that role is very different to the role required for people working on neurorehabilitation wards. So there's an emphasis in medical wards around direct care, but sometimes there needs to be an emphasis on neurorehab wards about enabling people to do things themselves rather than being the recipients of direct care. I think we need to consider that most of the people that we're supporting on the wards will be wanting to go back home, and most of them will be able to go back home. And so nurses could play a really great role in changing the ward environment so it more simulates home, because I think some wards can run very much like traditional wards, and then the patient doesn't have the responsibilities that they're going to have at home. So there's a real role in kind of helping think about how we can change the structure of the wards to enable people with brain injuries to do more, to be cooking their own meals more regularly, to be eating with other people, to try and simulate some of the conditions of home to get people ready for that transition.